Welcome to our channel. Today we're diving into the fascinating world of X-ray machines. Ever wondered how doctors can see inside your body without making a single cut? Let's find out. Let's break down how X-rays actually work. It all starts with a device called an X-ray tube. Inside you have a cathode and an anode. The cathode is a negatively charged filament that, when heated, releases a stream of electrons. Think of it like a light bulb filament, but instead of producing light, it's shooting out electrons. The anode is positively charged and placed on the opposite side of the tube. This positive charge attracts the electrons from the cathode at super high speeds. When these electrons slam into the anode, they produce X-rays. The X-ray tube is housed in a protective lead casing that only allows a controlled beam of X-rays to escape in a specific direction. This beam is what we use to image the body. X-rays are a form of ionizing radiation, meaning they have the potential to cause damage to living tissue. But don't worry, the amount of radiation used in a typical X-ray is very small, and the benefits of diagnosis far outweigh the risks. So we've got our controlled beam of X-rays shooting out from the tube. What happens next? The beam passes through the body, and this is where things get interesting. Different tissues in our body absorb X-rays to varying degrees. Think of it like shining a light through different materials. Some materials, like clear glass, let almost all the light through, while others, like a thick book, block most of it. Dense tissues, like bones, absorb a lot of X-rays. That's why bones show up as white on an X-ray image. They're blocking the X-rays from reaching the detector on the other side. Tissues like muscles, fat, and organs are less dense and allow more X-rays to pass through. This difference in absorption creates the contrast in an X-ray image, allowing us to distinguish between different structures. It's like a shadow play inside your body, with the X-rays painting a picture based on how much each tissue absorbs or transmits the beam. Our X-rays have passed through the body, carrying valuable information about what lies beneath the surface. But how do we capture this information and turn it into an actual image we can see? Behind the patient, opposite the X-ray tube, is a detector. This detector captures the X-rays that made it through the body and creates the image. Traditionally, X-ray images were captured on photographic film. The X-rays would strike the film, causing a chemical reaction that would darken the film to varying degrees, depending on the intensity of the X-rays that hit it. Nowadays, most hospitals and clinics have switched to digital X-ray detectors. These detectors convert the X-rays into digital signals, which are then processed by a computer to create the image. Digital X-rays require less radiation. The images can be enhanced and manipulated digitally, and they can be easily stored and shared electronically. Imagine being able to zoom in on an area of concern, adjust the contrast to highlight specific details, or even send the images to a specialist across the globe with just a few clicks. Digital X-rays have revolutionized the way we diagnose and treat patients. Whether we're using traditional film or a digital detector, the captured X-ray image often needs a bit of processing before it's ready for prime time. Think of it like editing a photograph. You might adjust the brightness, contrast, or sharpness to make the details really pop. In the case of X-ray images, this processing helps to enhance the contrast between different tissues, making it easier for doctors to identify any abnormalities. With digital X-rays, this processing is done by a computer, which can apply various algorithms to improve image quality. For example, it can sharpen the edges of bones, suppress scattered radiation that might blur the image, or even highlight subtle differences in tissue density. This processing step is crucial. It ensures that doctors have the clearest, most accurate images possible to work with, leading to more accurate diagnoses and better patient care. Image processing helps to eliminate those challenges, giving doctors the best possible chance of detecting and diagnosing even the most subtle abnormalities. So far, we've been talking about conventional X-rays, which are like taking a single snapshot of the inside of your body, but X-ray technology is incredibly versatile, and there are several different types of X-ray techniques that doctors use to diagnose and monitor a wide range of conditions. One such technique is fluoroscopy. Unlike conventional X-rays, which produce a single still image, fluoroscopy provides real-time, moving images of the internal structures of the body. It's like watching a live video feed from inside the body. Fluoroscopy is often used during procedures like cardiac catheterizations, where doctors need to see the movement of the heart and blood vessels in real time. Another important X-ray technique is computed tomography, or CT scan. CT scans use X-rays to create detailed cross-sectional images of the body. Imagine slicing a loaf of bread and being able to see the inside of each slice. That's what a CT scan does, but with your body. CT scans are incredibly useful for diagnosing a wide range of conditions, from bone fractures and tumors to internal bleeding and infections. And let's not forget about mammography, a specialized type of X-ray imaging that uses low-dose X-rays to examine the breasts for early signs of cancer. From conventional X-rays to fluoroscopy, Connecticut scans and mammography, X-ray technology has revolutionized the way we diagnose and treat a wide range of medical conditions. Thanks for watching. If you found this video helpful, don't forget to like, share, and subscribe for more informative content. Stay healthy and see you next time.